the motherland, the African man. Long as I'm alive, I'ma make a plan. Strongholds to break, got long walks to take, got no votes to make, we don't bet, we pray. Hey, African man, yeah. The African male iris, through the eye of an African male.
Welcome, guys, to the African Male Iris, and I'm DJ Tino. Thank you so much for joining us for another episode as we discuss certain topics and issues that affect men. And today I have a new co-host, not new, but temporary. You might find that Prayer Soul and Slim at the moment are not with us. They did have other commitments, but they will be coming through for the next episodes. But today I do have a co-host, and he will introduce himself. I'm sure you might remember him from a prior episode. You could go ahead, man.
Hi, guys. I'm Oscar Mataruka, and it's an honor to be back here. I love this show. I am I'm a fan and a subscriber, and I can't wait to see what happens. I love conversations. I particularly love hanging out with these specific gentlemen here, we're talking to Remmy today, and exciting stuff.
Exciting stuff indeed. Just to mention, Oscar, after your episode, we did get quite a few call-ins.
What was the nature of these call-ins?
I might need to share that with you in private.
Oh, man.
But yes, we do have a special guest with us today, and his name is Remmy Shawa, right? Also known as Dr. Shawa, which we will unravel as the conversation goes. Thank you for joining us, Remmy.
No, it's a pleasure to be here. I'm a big fan as well. I subscribed. So I follow some of the conversations, and I look forward to this discussion.
No, glad to hear, man. Glad to hear. So I think as we do with all our guests, we allow you, Remmy, just to maybe share with the audience what would you want to say about yourself as an intro, as Remmy.
It's a tough one. So, I was thinking about it.
Yeah.
When I was coming here, what would I want to say? And the question of who am I think, when you get to this age, you start pondering who you really are.
What age is that? Please be specific.
38.
Okay, all right.
So you start having the existential questions about who you are. So anyway, I think I will introduce myself based on what I value. Okay. So I'm a father of 3 children, married to 1 wife.
Yes, important to mention that.
Yeah, who I've been with from uni back in undergrad.
Oh, that's great.
I'm a Zambian to the core.
Yes.
An African, a Pan-African. I believe very much in the potential of Africa. So I've been here in South Africa for since 2011, Cape Town, and then here in Joburg. I love to travel for both work and pleasure.
Mm.
I used to tell myself that I want to go to all 54 African countries by the time I'm 54.
Oh, wow. How far are you there?
Wow.
So I think I've done about 20-something.
Not bad.
Wow.
Yeah,
Not
so
bad
I'm
at
not
all.
sure if I'll hit that. Yeah. So then we can learn more about each other as we talk.
Oh, that's great, man. That's great.
Yeah, I just want to find out. So you are Dr. Shawa, and I understand your doctorate is in public health.
Yeah.
Why? Why public health?
That's an interesting one. So I did my undergrad in the arts. And before I went to uni to do my undergrad, I was exposed to the HIV work. So that's like, introduction to work was around HIV. Peer education, community service, and so on. So the path was kind of already mapped up going into undergrad. And then, I did my BA, and my research was on HIV. So moving into masters, I made a deliberate sort of decision that I want to broaden my scope and then move away from just a narrow focus on HIV and, think more public health systems. Actually, my master's was in public health systems. So that then, sort of led me into the PhD in public health. Interestingly, I never wanted to do a PhD.
Right.
I don't like studying. My wife is the academic. I'm not. But so one time, I was in Durban for work, and one of my lecturers from my master's program then reaches out and says, Remy, would you be interested in doing a PhD with me?
Oh,
right?
wow.
Yeah. So I'm like, I've never thought about it really. And he's a medical doctor who's now into public health and human rights. So my PhD is sort of on the nexus of public health and human rights.
Right.
In particular, I was looking at the right to enjoy the benefits of scientific progress and its potential for enhancing access to drugs for drug-resistant tuberculosis. So that was, it wasn't very, very academic. It was out of it. It was quite a lot of policy influence and so on. Yeah.
Yes.
Okay. And are you aligned with what you did? Are you aligned with what the work that you're doing right now? Maybe you could share that.
So not my PhD, actually.
Okay.
In fact, if you ask me, the PhD has changed nothing at work.
Okay.
I didn't even get a promotion. I got a promotion, but not because I got a PhD.
Okay. I see.
So my work, I work with UNESCO, which is a UN agency on education, science, and culture. And it has different sectors. So education is one of the biggest sectors under UNESCO. But within that, education for health and well-being. So somehow the public health components come in,
Right.
especially when you're looking at supporting the ministries of education to address health challenges within the education system.
Right.
Okay.
So issues of pregnancy in schools, outbreaks, cholera, COVID, violence in schools as well, drugs and alcohol and stuff like that. So that's mostly what I do.
Okay. So are you on the ground? Do you actually get to interact with some of these cases?
Not as much as I would. It's mostly policy advice, right,
Okay.
and normative guidance. So a ministry says, we're battling this issue. How can UNESCO support? And then UNESCO goes, okay, what are the normative standards? Where can we draw some lessons within the region? I cover East and Southern Africa, so that's about 21 countries. And you do the cross-learning and cross-sharing from other countries. And then once in a while, you get the opportunity maybe to interact with teachers themselves who work with learners and sometimes with learners. Interestingly, in 2011, I was at UNHCR, and in March, I think, February, I resigned. And I still have the resignation letter that I gave in at UNHCR to go into civil society, into the NGO work. And I thought as a young person, the UN wasn't the place for my energy.
Okay.
You know, you still want, like you are saying, interacting with people on the ground,
Right.
with young people, with learners and so on. And I thought at that time it wasn't the best fit. So I stepped out actually from the UN system for quite a while, and went into activism.
Activism.
Oh,
Yeah.
okay. And how did you circle back?
So I grew older.
Responsibilities.
So and I think whilst I was in activism and civil society, I still used to collaborate quite a lot with the different agencies. So UNAIDS on engaging men and boys in sexual and reproductive health. So by that time, I was leading a program that was looking at how can men be clients of services like SRHR services. How can they be change agents in their communities, and how can they be better partners to their partners?
Do you have a practical experience to share on that one?
Yeah, kinda. A lot of things are just going through my head.
I can imagine.
So I mean, one of the challenges, right, that we were facing and we still face now, is that the health system is designed. Well, first of all, it's not designed for anyone, like in an African context.
Yeah.
I mean, if women didn't have to get pregnant, chances are that they wouldn't be at the health facility as often, because no one likes to be in that space.
That space, yes.
So the way that the interventions have been designed on our continent, at least, is tailored toward women and girls. And not just any women and girl, but women of reproductive age.
Right.
And not just women of reproductive age who have the time. Right? So you find if you're a working woman, it's difficult for you to find time to just go to a health facility for like a normal checkup. So that was the situation for most men. They wouldn't find themselves around health facilities, whether it's for prevention or for treatment. And what would happen in the HIV space then is that I don't get to test my status as a man. I rely on the status of my wife.
Right.
Because she goes
there to antenatal and whatnot. And then around 2009, it started being clear that whilst the face of the HIV new infections on the continent was that of a woman and of a girl, and it still is, the face of AIDS-related deaths was that of a man.
Wow.
So more women and girls were getting HIV, but more men and boys were dying of AIDS because of lack of testing, access to services, and so on. So I was working in that field, working with UNAIDS, who were my previous employer before, working with UNHCR, to look at male refugees, and UNESCO, because then they were moving into the education sector and looking at what can the education sector do. So when an opportunity came up at UNESCO, I thought, let me give it a go. I applied for this job 3 times. And I interviewed 3 times.
Wow.
I only got it after the 3rd.
Were they separate interviewers?
Different interviewers. So first time I was unsuccessful.
Yeah.
Second time unsuccessful. Third time is when. Yeah. So they would hire, right? They would advertise, and then they pick their best candidate.
Yeah.
And then they don't perform or something. And then they advertise again. And I apply. They pick someone else, the same thing, and then but I later came to learn that my age was one of those factors that
was making them
is he
experienced?
Is he experienced? Is he old enough to manage the responsibility of this role?
Right.
And so you, as a young person, you constantly had to prove yourself.
Exactly.
Yeah.
No.
The motherland, the African man. Long as I'm alive, I'ma make a plan. Strongholds to break, got long walks to take, got no votes to make, but don't bet, we pray. Hey, African man, yeah. The African male iris.